Welcome to today's Explainer. We're going to unravel one of the most terrifying, absolutely perplexing medical mysteries in recent history. Seriously, we're looking at a true life or death puzzle that completely stumped medical professionals and turned into a frantic, literal race against the clock. Let's get right into it. So, picture this. How does a man who never leaves his house contract one of nature's most terrifying and deadly viruses? It's your classic locked room mystery, right? But instead of a crime scene in an old mansion, the locked room here is a human body. Let's look at the clues together and see if we can solve it.
Our story kicks off in an emergency room with patient J.A. He's a 50-year-old male, and when he rolls through those ER doors, his presentation is just frantic. He can't even speak to the admitting nurse. He's foaming at the mouth, his neck muscles are completely rigid, and he's completely overwhelmed by severe anxiety. Just looking at him, you know clearly something is deeply, deeply wrong with his brain.
One of his most severe symptoms was paresthesia. Essentially, that's a deviated feeling. But for J.A., this wasn't just a tingle. It translated into a horrifying, visceral, burning sensation in his forearms. He literally felt like he was on fire, even though his skin was completely untouched by any physical burns. Just imagine how terrifying that would be. Okay, let's dive into Section 1, the road to transplant. To really understand how Jay ended up in this terrifying state, we have to look backward at his medical journey. It actually started 15 years ago when he began taking a specific herbal supplement from the Aristolochiaceae family for his breathing. But here's the catch. The active ingredient, aristologic acid, is highly nephrotoxic. That means it systematically destroys the kidneys by inserting itself into the cell's DNA, turning the organs into a stiff, fibrous shell. 3 years ago, this caused total kidney failure, forcing Jay into years of grueling dialysis. Finally, his life-saving day arrived. He received a kidney transplant from a deceased middle-aged donor out in Idaho. Now, to make sure Jay's body didn't immediately reject this new kidney in a terrifying process known as graft versus host disease, his doctors had to completely neuter his immune system. They used a super intense 3-step regimen. We're talking steroids to decrease white blood cells, a medication to block immune signal production, and another one entirely to stop white blood cell replication. This successfully saved his kidney, for sure, but it left him incredibly, dangerously vulnerable to infection. Section 2, ruling out the suspects. Everything seemed great at first, but fast forward 5 weeks post-transplant, and J.A. begins this rapid, horrifying 7-day decline. The symptoms just escalated wildly. First, burning in his elbows led to a sudden collapse. Then, he developed severe pee fright, meaning he was physically unable to urinate despite having the urge. He became heavily disoriented and suffered from violent shaking. But you know what the most terrifying symptom was? His uncontrollable choking on water. Whenever he tried to drink just to take his life-saving immunosuppressants, his body violently rejected the fluid, forcing water into his lungs. He developed this overwhelming gagging sensation anytime a glass even came near his face, which eventually forced him to stop taking his medications entirely. So when his wife called 911 and they got him to the ER, the medical team made a very logical first guess. Meningitis, right? I mean, a fever and a stiff neck in an immunosuppressed patient strongly points to brain membrane inflammation. But look at the mismatches. When they tested his cerebral spinal fluid, it was perfectly clear. No abnormal protein, no glucose issues. Whatever it was, it absolutely wasn't meningitis. The medical team had to act like detectives, systematically eliminating suspects. Since his decline happened over 7 days, not 7 seconds like a stroke, or 7 years like ALS, they knew for a fact it was an infection. But which one? Well, tetanus causes swallowing issues, but not an altered mental state. Diphtheria causes swallowing issues too, but also facial drooping, which J.A. didn't have. Botulism causes paralysis, and J.A. wasn't paralyzed at all. That left only one terrifying viral suspect on the table. Which brings us to Section 3, the shocking rabies twist. Remember how J.A. was violently choking on water and gagging at the mere sight of a glass? Well, that extreme aversion to water is actually called hydrophobia, and it is entirely unique to rabies. Let that sink in. The CDC stepped in, tested J.A.'s saliva and spinal fluid, and boom, they found rabies viral RNA. Now, what's absolutely wild about the number 125 is that it represents the total number of human rabies cases reported in the entire United States over a 58-year period from 1960 to 2018. Contracting this virus is incredibly, almost impossibly rare. And this brings us right back to our locked room mystery.
If JA had no pets, didn't go outdoors, and was totally isolated inside on immunosuppressants, how on earth did a silver-haired bat variant of rabies get inside him? Well, the only breach to his physical isolation was that transplanted kidney.
Let's move to Section 4, Tracing the Deadly Path. Investigators frantically pulled the Idaho donor's medical records, and initially, they found absolutely no mention of rabies. None. But an interview with the donor's family revealed this hidden timeline of doom. In late October, the donor kicked a skunk to protect a kitten, and he got what he thought was just a minor scratch on the shin. By December, he developed a stiff neck and died suddenly. Then came the transplant. And 5 weeks later, Jay's nightmare began.
So how did they miss it? Well, rabies has a terrifying biological roadmap. It doesn't travel through the blood. It travels silently through the nervous system. It replicated right at that minor scratch site, sneaked into the nerves at the neuromuscular junction, slowly traveled up the spinal cord to the brain, and then suddenly exploded outward into highly innervated tissues. That includes the salivary glands and, tragically, the kidneys.
Moving on to Section 5, Lessons and Life-Saving Advice. Tragically, because his immune system was wiped out and his diagnosis was delayed, the disease was simply too advanced. J.A. passed away on hospital day 7. But guys, the nightmare wasn't over. The donor's corneas had already been transplanted into 3 other patients across California, Idaho, and New Mexico. Public health officials had to scramble in a literal race against time to track down these patients, remove the grafts, halt another scheduled surgery in Missouri, and urgently treat dozens of exposed healthcare workers. And here's the truly chilling part. This exact nightmare scenario has happened before. Back in 2004, doctors in Texas watched 4 organ transplant patients progressively lapse into comas and die within 50 days of their surgeries, all of them from a single organ donor who had an undetected rabies infection. It's an exceptionally rare but known risk in the transplant world.
So how do we defend against this? If you're exposed, the treatment is post-exposure prophylaxis, or PEP. It's a 2-step process. First, administering antibodies that immediately neutralize the virus, and second, getting a vaccine that stimulates your body to produce its own long-term antibodies. When health authorities tested the Idaho donor's old blood samples, they found he had 0 antibodies. He never sought this life-saving treatment after that skunk scratch.
This brings us to a massively important public health takeaway. If you are ever scratched or bitten by a potentially rabid animal, like a bat, a raccoon, a skunk, rabies prophylaxis is a medical urgency. You don't have months or years to wait and see symptoms develop, because once symptoms appear, it is almost always fatal. You have a strict window of just a few days to get treated and survive. Period. Which leaves us with one final lingering thought for this explainer. Could an organ donor be hiding a deadly secret? Now look, the organ transplant system saves countless lives every single day, and you absolutely shouldn't panic. But this story teaches us a really powerful lesson in vigilance. If you or a loved one are ever receiving an organ, it is totally worth asking the medical team about the donor's history, specifically making sure they didn't suffer from an unexplained acute encephalopathy or sudden brain inflammation just prior to their death. It's a tiny detail that, as we've seen today, can quite literally be the difference between life and death. Thank you so much for joining me on this deep dive, and I hope this knowledge leaves you both fascinated and fiercely informed.